here is the submucosa. And then this outside layer right here is the muscularis externa. It consists of two separate kind of compartments of smooth muscle. This is the stuff that peristalsis occurs in. The contraction of this causes peristalsis. And then on the very outside is the fourth one up there, which is the serosa. So this kind of gives you an all-in-one model of everything. There's other things on here, like what's this blue thing? Well, you don't need to know yet. Or what's this green thing? Well, you don't need to know that yet either. But anyway, so I'll leave this up here because I'm probably going to need it again. So let's talk about the histology of this system. The mucosal layer, well, you know what? I'll just use this at the same time. This layer here, the mucosal layer that's spanning my fingers right now, is divided into three sort of compartments. There's a lining epithelium, so this would be the epithelial lining, right? And it's almost always, except for one exception, it's almost always simple columnar. There's a little bit of connective tissue in here, and that's called the lamina propria. So the connective tissue would be just sort of this stuff that's kind of along the base here. And then there's a thin little layer of muscle, which is called the muscularis mucosa. That's like a dividing one. So you can see that pretty well on a microscope. Actually, you can see it real well on a microscope. And the next layer is the submucosa, which is this one. It's mostly connective tissue, blood vessels, nerve, lymphatic tissue, things like that. And then we have the third layer here, which is the muscularis externa, which consists of two layers of smooth muscle. The one closest towards the submucosa is always, in terms of its arrangement, is circular. And the one on the outside out here, and you can see the difference under a microscope, it's actually pretty simple. The one out here is longitudinal. So it always goes in that direction, always goes circular, then longitudinal. Right? So this is the muscularis externa. This is peristalsis. So those are the layers, and that's the stuff I'll be showing you tonight. This next picture is a picture from your book. Go back. It's a picture from your book, and really this is kind of like maybe just sort of one of these things, just one section of it. This is the whole tube, and there's some on here I want to show you. It's this fold, and it's called a plica, like a pleat. And the reason that the intestinal wall is so highly folded has to do with surface area and available absorption. Right? If it was just a flat, smooth tube, our guts would have probably be longer to absorb whatever we eat. So you always see these folded things in here, which are called plica. And on the ends of the plica, see here's the plica, this fold, and on the ends of the fold you have the tiny little fingers, which are the villi. So it makes it for a tremendous surface area for absorptive purposes. So here we've got this area is the mucosa, submucosa, muscularis externa. Right? And this is the stuff I'll be showing you tonight, on the slides. So look, I don't want to erase what Shani wrote there because she put up a really good memory thing. So I'll leave it up there because I don't know that one. So anyway, so you can see the layers, and this is what it's going to look like when you see the stuff tonight. The nice thing about it is that the layers are all the same from the esophagus all the way out through the large intestine. It's all the same. Okay? Not much changes. So once you get one down, you can't get them all. All right, we'll come back to that in a minute. Now let's do the oral cavity. We've got some teeth models over there. Let me go get a tooth. Then you talk about teeth. I keep saying that one of these days I'm going to buy myself a pair of those with teeth that you can wind up and they chatter, but I've never done it. So I'll just use this tooth. Right? Bad tooth. It's got tooth decay. So the lining epithelium of the mouth is stratified squamous for protection of the food we eat. All right. So what's in your oral cavity? Well, your tongue. It's kind of important. When you bite it, you know it's there. But it's really important for, mashing up your food, and, without a tongue, you don't talk real well either. So, pretty important. And then you got teeth, 32 of them, presumably. Okay, I'm missing one, so I think I got 31. I yanked a few years ago, or many years ago. So 32 teeth, we'll get to the teeth in just a second. And then, importantly, the salivary glands. That's the next slide. And this word, amylase. Amylase is an enzyme that begins the breakdown of starch. So if you're eating a piece of bread or pasta or something like that, your salivary glands secrete saliva, which moistens the food, but also amylase is in there, which begins to break down the starch as you chew up something starchy, like potatoes even, right? So the salivary glands secrete saliva, but also an enzyme called amylase, and it's for breaking down starch. The salivary glands, there's a picture next, parotid, sublingual, submandibular. They're all up here in your face. There's the picture. So here are the parotid glands. There's one on both sides, kind of like right here. They got little ducts that go in. Submandibular glands down here, and then sublingual gland under the tongue. And everybody knows how salivary glands work. You know, whenever you smell something that smells really good and you're hungry, maybe you're not even hungry, but it smells really good, salivary glands start to secrete, right? Just can't not do it. It's going to happen. Not that you need to know it, but you don't need to know it, but I'm going to say it anyway. There's a childhood disease, don't see too much anymore because of a vaccination called mumps, which is a viral infection of the parotid salivary gland, causes your neck all to get swollen and stuff. You don't see that too much anymore. Anyway, so this is the salivary glands and where they're located. Where are they? Let's see. Actually, the mannequins have salivary glands represented on them, and also one of these old charts that people keep pointing at stuff and the numbers disappear. But this particular cutout here, salivary glands, and this one actually shows the tonsils and the uvula and some of the teeth and stuff like that as well. Okay. What's next? Tooth, like this guy. Open him up. Not this one. All right. So what do we got? Well, we got this stuff. Well, this is decay. Bad tooth. Right? So we got this stuff, which is the enamel, which I think is the hardest substance in the body. It's harder than bone. It's really, really tough stuff. And it covers some very soft underlying tissue called the dentin, right here. And then in the center, we have what's known as this thing here, which is the pulp cavity. The pulp cavity is where the nerves and blood supply to the tooth are located. So if you've got maybe an abscess or something like that, and you go to your dentist, the dentist goes, "Oh man, I don't want to pull the tooth," because you really don't want to lose teeth. The only way I can save the tooth is to do a root canal. Right? Maybe you've had them, I've had one. Right? What they do is they basically go in, they drill out the inside of the tooth. The tooth's now dead, but at least it's in your mouth. It's not a hole there, which is going to cause perhaps problems later. So it's this area, the pulp cavity. So it's the enamel, the dentin, the pulp cavity. The tooth is set into the jaw through structures called periodontal ligaments. They're of course very strong. But a couple other things I want to mention here is this is the fancy word for your gums, gingiva. Right? For those of you who are going to be dental hygienists, you know all this. And then here's the gingival sulcus. That's the little place that you're supposed to do this now. You're supposed to get dental floss. Right? You're supposed to floss every day. And you need to get those bacteria out of there. Because now I sound like a commercial for like mouthwash or something. But the reason for this is the bacteria, we consume, us, you, me, consume more sugar in our diet than we need to. And the sugar in our diet is broken down by the bacteria in our mouth. And we have a ton of bacteria in our mouth. It's a zoo in there, right? And if you have bacteria and food products and things like this in these gingival sulcus here, and you don't remove them through regular flossing, the bacteria can break down the sugar in your diet and produce acids, which over time cause stuff like this, tooth decay. So it really is important to to do that. And who wants to? I mean, not many people really look forward to going to the dentist, but you certainly don't want to sit there and have the dentist say, "Oh man, you've got periodontal disease," or we got to yank this tooth or whatever. So actually my hygienist, I've been seeing this gal, her name is Darcy, I've seen her for kind of a long time. My dentist, I used to live in La Jolla years ago, and once you get a dentist you kind of like, it's kind of like, every time I drive up there, I go, "Oh crap, I drive all the way to La Jolla, it's not a big deal." But Darcy, I've been seeing her for a long time too. She actually works at our hygiene program. We have a dental hygiene program at Southwestern College. It's a really, 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 really good program. And she works there as an adjunct instructor now, and she really likes it. She claims that it's a tougher program than